Did you know that over 50% of women in the menopausal transition have pelvic floor dysfunction and they never tell their provider? Are you a part of that 50%? You cough, you sneeze, you laugh, and you leak a little bit. I'm here to tell you, it's not you, it's your hormones. I'm Dr. Jess, your board certified clinical pharmacist and hormone strategist, and I brought my girl in, Dr. Lacie. She is a pelvic floor physical therapist, and she's going to break down all of the things regarding pelvic health. So take a seat, take a breath, get ready to learn about the floor you've been ignoring, and maybe I have too. Welcome to Reset with Dr. Jess. I'm Dr. Jess, your board certified clinical pharmacist and hormone strategist. Today, we're going to be talking about the thing that nobody really wants to talk about, including me. But that's what happens to your pelvic floor as your hormones shift. All right, Dr. Lacie, welcome to the Reset with Dr. Jess podcast. Thank you for joining me and sharing your expertise today. Of course. You are my favorite pelvic floor physical therapist, just to let you know.
Thank you.
Okay. I wish I could send everybody to you. I would come to you if I could, but it's probably lucky for you.
I get it.
All righty. Yeah. So I want to just hop in. I want to learn about you, how you got started as a pelvic floor physical therapist, or if you just started as a physical therapist and then shifted into pelvic floor. And then I know that you and I work together. So you teach one of our menopause group classes on pelvic floor physical therapy. So I want to kind of get your out of work perspective on how the group goes. But tell us about Dr. Lacie.
Yeah. So I've had patients ask me this before because my job is admittedly very weird. And it's a question that comes up a lot during initial visits, during a patient's consult of like, you know, I've got poop charts. I'm asking about their sex lives. There's all of this just not normal for everyone except for us. So how did I become a pelvic PT? When you go through PT school, you're trained as a generalist. So you're equipped to treat any part of the musculoskeletal system. Although now I would say except for the pelvic floor. There's very, very little. I do have students from a couple of universities that have a pelvic floor elective, which I think is awesome. That was not a thing for me in school. So I started working as a PT and had at that different boss now, but had a very supportive boss. And I said, hey, I think I want to do pelvic floor stuff. And he was like, sure, go take the classes. Don't talk to me about the things, but just go do the thing. But how I didn't know that pelvic PT was a specialty going into PT school. And I was with a group of friends, and one of the girls kind of pulled me to the side and was like, hey, Lace, and I mean, this is like a week before I start. Did you know that vagina PT is a thing? And I was like, as a matter of fact, no, I did not. And she was like, well, it is, and you should totally do that. And I was like, what is that? What are you saying to me right now? I don't know what this means about me. But after for so long, I think what it means is that she knew that it wouldn't bother me to talk about all of this, that my comfort level is like, you know, let's talk about your poop. Just that it's easy.
You're good with that.
And it's easy for me to meet someone new and find something to connect with them on, that, at least from my perspective, I think makes it more comfortable for them to talk about all of the things. So I think, and I take it as a huge compliment. I think that's part of what she was saying of just, I think people will talk to you about this stuff.
And I know they do.
Yeah, they do.
And the patients that have worked with you, they love you because you do make it very, very comfortable and something that can be uncomfortable.
Oh yeah, for sure.
That's so odd. Like, I guess it's not odd, but pelvic health impacts men and women. But, you know, my mind always goes to women's health as a women's health pharmacist and hormone strategist. And so I look at the training aspect for women's health and it's typically none. So even in your world as a physical therapist, there's also that gap of knowledge to care for men and women, but women in this stage of life, in that hormonal shifting stage of life where these changes typically come up, or after pregnancy, having children, where these changes come up. So that's
it's a huge gap. I will say that again, because we're trained as generalists, and that was one of the things that drew me to PT in general, is like this, that could be like 40 different jobs, right? Like all of the areas that you can specialize in. So for the pelvic health training, there are a couple different entities you can go through for that, but for all of them, it's a series of courses that of course starts basic and you work your way up. Starts with only assigned female at birth bodies, and then later you learn about the penises and all of that. You can do an OB track, you can, so you just have to you have to get into it more. But still, I will say and this was 10 years ago, but when I went through the coursework, there wasn't a ton on the menopause transition. I don't remember there being a lot of detail on all of the hormonal shifts. And I think something that's really important in like how you and I collaborate is like, PT is awesome, but maybe we also need to think about hormone replacement and getting in other disciplines.
Yes, we come together and we make things better, and I love it. Can you just explain to the listeners what pelvic floor PT, what that actually is? Because some people might be listening and have no idea what we're talking about.
Yeah, I have patients that it always makes you kind of giggle, particularly because I do some of my appointments over video. And I have had patients that we log in and they're sitting on their floor and they're like, I'm on the floor, I'm ready to go. It's pelvic floor PT. I'm like, oh no, that's not different floor. But there are not everybody, again, back to not everybody talks about this stuff. I speak with plenty of patients that just have very limited knowledge of their own bodies and of anatomy and how our bodies work. So I wish I would have thought to bring home my little model, but
oh yes, I love the model.
So your pelvic floor, if you picture, like, if my hands are your hip bones, right? Like if you're feeling sassy, you can put your hands on your hips, these like wing shapes. You've got then like the underside, this bowl of muscle, and they're kind of, it's like a basket weave situation, right? So nothing falls out. So everything is very well supported. And you've got, bladder, uterus, rectum, and then all of your other organs resting on this pelvic floor. So it's just the network of muscles. There are different layers. They've got different, real specialized jobs that they do. But also one of the key pieces is that they need to work well together. They need to be well coordinated to not have symptoms. So coordination is a big thing that I work on with patients. So these muscles have the job of holding up all of your organs, regulating the pressure within your abdomen. So you've got pelvic floor muscles and then your diaphragm up here. They have a lot of work that they need to do together. But then function of your bladder, your bowels, sexual function, a lot of really, heavy hitters, things that are important for quality of life.
Very important.
For managing.
I mean, just imagine like you're trying to hold up all of this. You got pressure. I know you call it like a piston from the diaphragm that's going up and down. And no one ever thought about this being something to talk about.
I know. I want to like rewind and have high school health class. Like,
yes,
just even just saying like, hey, vagina PT is a thing, right? Like it doesn't need to be in all the detail that we go into with our patients, but just for people to know that these, if you have these symptoms, you've got options. You've got a lot of choices, a lot of treatment paths. When we're like an initial OB appointment, that would be a great time. A first pap smear, like we have all of these
Great
options,
time.
like landmarks, right? That we could just let people know that this is an
That is
option.
a thing. Yeah.
Mhm.
I'll typically lead in with patients when I'm going to approach the topic of pelvic floor PT. I just tell them, listen, if you're older than 5 years old, you
Mhm.
probably need to go to pelvic floor PT. And
Yeah.
they're like, okay.
Yeah.
So we mentioned some symptoms. You mentioned the term symptoms. And thanks for breaking that down, because now all I'm thinking about is the picture of
Yeah.
the basket and the muscles that you share. So if you are listening, pause this, go Google a picture of the pelvic muscles so that you can see what all it's supporting. Okay,
Mhm.
so all of these other things are going to make sense. Okay, I'm going to just put myself out there because I know a lot of people just say, I'll deal with these symptoms later.
Mhm.
So I want to talk about what those symptoms are first before I put myself on blast. And then I'll kind of get into why do we do this?
Right.
Why do people, I am people, just
Mhm.
say, I'll deal with this problem later?
Mhm.
So I know what it looks like when patients come to me with symptoms of the menopausal transition. Typically, it presents as a patient saying, oh, yeah, I pee a little bit when I cough, or I leak a little bit when I run, or, it's always about the leaking.
Yeah.
But I know there's a constellation of symptoms that are present in pelvic floor. So if you can kind of give us your maybe top 10 or top 5 symptoms for pelvic floor dysfunction and what someone might actually be experiencing.
Yeah. So I have a patient in mind that you referred to me that I saw on Friday, did her initial appointment. And it was exactly that chief complaint going through the menopause transition, some leaking with coughing and sneezing. And so she came in with, this is the thing that bothers me. This is my symptom, right? My one thing.
Mm-hmm.
But through that intake assessment, I ask about other bladder symptoms. So, is it a strong sudden urge when you need to go? Do you pee too often? Those are other really big ones that I hear about in this kind of time frame. Is it hard to get the pee out? Do you feel like you have to strain, or it's like taking forever? So I ask a bunch of other bladder questions. Um, so again, I think leaking is still like top of the list, but also that
Yeah.
urgency and frequency are things that people don't necessarily think about. But then when I ask, like, oh yeah, that does really bother me. Like I want to be able to sit through dinner without having to get up
Mm-hmm.
and break this conversation, go pee. Then I ask about bowel function. So, how often do you poop? Pull out my little chart with all the pictures. What does your poop look like? Does it hurt? Do you have to strain? Do you feel like you're fully emptying? So many people are constipated and have no idea. And so this gal of yours that I saw, urgency, frequency, terrible constipation. She's
Mm.
also on a GLP-1, so that adds
Makes it worse.
um,
Mm-hmm.
but people are often very surprised to hear that they're constipated because it's just what they're used to. Um,
Yeah.
but it has a big impact on, again, because if you think bladder, vagina and uterus, rectum, if you're backed up, this poop's got to go someplace. So it can end up
Mm-hmm.
contributing to bladder symptoms. It can also cause back pain because if you picture it, like you've got now pressure going toward the spine that's not meant to be there. The other big set of questions that I ask are about sexual function. So, is there any pain during any type of sexual activity? Does it hurt to climax? Is it difficult for you to climax? We talk about changes in lubrication. That's a whole other big thing that
Yeah.
people
I'm
aren't
just thinking in the
necessarily
chart.
prepared to discuss. Like, hey, lady that I've known for 10 minutes, cool. Let me tell you about these very intimate and anxiety provoking. Like, that's the most like
Mm-hmm.
for most people, the most emotional component of all of this. But I would say by and large, my patients have symptoms in all three of those categories. It's very rare for somebody to say, I leak when I jump, and we ask all of that, and that's really all we need to address. So it's complex, and I think that can be overwhelming to patients. But I compare it. My visual is like, yeah, but we get to like roll the snowball uphill. So everything that we're doing for your constipation is also going to help your bladder function. And this thing that we're doing for your sexual health is going to help your hip mobility. It all works together to cause this cluster of symptoms, but then we get to treat the whole cluster together.
Yeah, it's almost like, I mean, it's not almost like, it is non-hormonal therapy. It's what you can physically do outside of hormones, but it's also kind of like when you do hormone therapy, all of these symptoms that you're experiencing, when we replace what you're losing, we kind of fill that hormone cup back up. All of those other symptoms get better.
Yeah.
So if you're doing these certain exercises from pelvic floor PT, all of these other symptoms are going to start to get better together.
Yeah.
That's awesome.
It is.
I'm learning things.
Good.
And I want to talk about sexual function too. So we'll kind of dive a little bit deeper into these symptoms that you're mentioning, because almost every single patient that I talk to, or woman that I talk to, just like at the grocery store or at church or just a family friend, they always talk about the leaking. And then when you start to delve deeper into those symptoms, it makes sense that they all come together because the entire pelvic floor is dysfunctional.
Right.
So everything that it manages is now dysfunctional. And that's why I say this is the floor we ignore.
Yeah.
That's the title.
Yeah.
We just ignore it. I'm an ignorer. Let me tell you guys.
Tell us about it.
Come close. Okay. So like for my ladies who are late 30s, early 40s, they haven't had this shift in their cycles yet, but they're starting to have some perimenopausal symptoms during their luteal phase, so that second half of their cycle. And I know for me, maybe 5-7 days before my period, I can leak a little bit when I laugh or cough or sneeze. And I was like, man, do I need to go to pelvic floor PT? Right. I keep sending everyone else. And so my provider said, yeah, you probably should go. And I was like, yes, sign me up. I'm going to get that scheduled. They have called me, Dr. Lacie, and called me. And I said, oh, I'm with patients.
Yeah.
I can't do this right now. And I still have not scheduled it. What do you say to women like me? Yeah. I am the problem. But what do you say to women like me?
It's multifaceted, right? Because we have all of these different areas of our lives. We've got friends and family, we've got our jobs, we've got all the things that take up our time and our mental load. And then we have, the patriarchy. We're women. We're expected to do for others before we take care of ourselves. And I feel like that's something to consider and just be aware of. I do love, like, for myself and for the women in that age group that I'm around, this kind of shift in like internal power dynamics of like, I am here and I am going to take up space and I'm going to do the things. And so that's kind of my pep talk for patients is like, this is a big transition in your life, and it's a big opportunity for growth. Like, it doesn't just need to be menopause, like it's over, right? So kind of embracing it as just a prompt, an opportunity to pour back into your own cup. I think, though, just normalizing and talking about the fact that there are fears that it's not all logistics. It's am I going to get along with this person? Am I going to like, what's the personality of my therapist going to be? Are they going to be like super doctory? Or are they going to be
Mm.
somebody like me that's like pretty chill and a smart ass and like going to just tell you how it is, right? Um, Not knowing what that first exam is going to, or first appointment, I should say, what's that going to involve? Is it going to involve an exam? Am I going to say I leak when I pee and they're going to say, cool, show me your vagina? Like
Right.
what happens in between? So I think the more that people are aware of pelvic PT as a thing that exists, the more that wall will come down so that you have an idea of, because I mean, when you like if we think about when we're teenagers and like I took my 11-year-old to their well child visit and like last week, and their doctor's asking the questions of, where are we at with puberty and have you gotten your period yet? And even at 11, their doctor brought up, when you get your period, then, you'll have this different type of exam. So there's this foreshadowing of this is a
A
thing that's
preparation.
talk about. Right. And so I feel like just having these discussions so that it's more common knowledge, like this is what pelvic PT is. My hope is that would make it easier for people to take that leap into making their appointment. A lot of it, I know, like where I work, I've done a lot of marketing within that healthcare system, talking to urology, primary care, psychologists. Here's what pelvic PT is. Here are the patients that you need to send to me. And so just doing all of this work, I hope will take away a lot of that fear surrounding it.
You are leading the charge, I will say. And because of you working with you, I'm not afraid to set the appointment, but I do believe there's some hesitance of it's not that bad yet.
Yeah.
Because it only happens during the luteal phase when those hormones drop and there's a change in the estrogen to the vagina and how those things kind of in hitting the bladder and how those things come into play. So, the rest of the month I'm great.
Right.
So am I doing, go ahead.
No, it's just excellent point. And this is, I hear this a lot of like, it's not that bad. And it's not just pelvic floor, right? It's my ankle hurts too. It's just not that bad. Like I can still function, but most things in life, and particularly with health, with our bodies, the sooner we can start to address it, the better. Like let's move I'm trying to think of a visual analogy, but let's just address the problem when it's minor and it's going to be a quick fix. And then it's also going to be preventative. It's going to set you up for success so that when you're 60, you're not, you're not wearing 3 Depends a day. You're taking care of future you now.
Okay. Future Dr. Jess is saying, girl, set your appointment. Okay.
Yes.
Listen to Dr. Lacie. You're right. All right, fine, guys. All right. I know I'm not by myself. So if you're listening to this and you are having these similar symptoms, you know who you are. You're jogging every day and you leak a little bit. Okay. That's you. Talk to your provider about pelvic floor PT. If your knee was hurting, you go.
Yeah.
Well, hopefully.
Yeah.
Anyway.
For all the things.
So, okay. We kind of talked about some of the myths surrounding that pelvic floor is just about leaking. I'm glad you really broke that down. Okay, well, I don't want to just be the only one here putting all themselves out there.
Sure. Yeah.
So, you're a clinician in this space. You've been doing this for well over a decade now. You have all the training, but you are also a woman. You also have a vagina and a bladder and a pelvic floor bowl. Okay.
Yes.
Have you ever had to practice what you preach?
Yes, absolutely. Absolutely. I So I have 3 kids. The oldest is a stepdaughter. So I didn't do any of the birthing things. So I've carried and delivered 2 babies.
Mm-hmm.
And the first was a very dramatic C-section situation. Um, and so while I didn't push them out, right? Like my pelvic floor muscles were saved that experience.
Mm-hmm.
Um, I had this major abdominal surgery, and like that's in the whole other soapbox is like C-section is major surgery. Quit talking about it like
Major,
it's no big deal.
major,
I
major surgery.
would 100 times over rather my son was 9 pounds. I would rather deliver that kid naturally over and over versus a C-section. It was so much of a longer and more difficult healing process.
Mm-hmm.
Um, and so part of that was I had this abdominal pain. It was on the right side of my incision, and it was this sharp, it just hurt. It was worse if I did any sort of exercise. And it was scar tissue. It was a restriction in mobility, deep in my abdominal wall, into my pelvic floor. And it made things hurt. It made sex uncomfortable sometimes. Um, so I went to a pelvic PT, a woman that we didn't graduate together. We went to the same high school. We're both local. I've seen her at we've done similar Con Ed courses. So it was this kind of cool, nerdy conversion.
Connection. Mm-hmm.
Uh, but so I went to pelvic PT, and it was a cool experience being the patient. Gave me more insight into how I want to practice. So she did an internal exam, and we were able to pinpoint like, okay, this muscle internally and then this muscle externally are where we need to focus, and did just some hands-on work to I was related to shoulders, right? Like who doesn't have a tight upper trap? And it hurts. And so you just are naturally going to do this. You're going to smash it and help that muscle to
Try to
relax.
work it through. Mm-hmm.
Yeah. Yeah. And so did some similar kind of treatments, but in my vagina. And that got so much better. I can still tell that, I've had a C-section. If I go to a particularly rigorous Pilates class the next day, I'm like, oh, yep, there is that, it just aches a little bit differently. But that was a big one. And then more recently, with this, I mean, I'm about to be 44, so I'm in the zone,
Whew.
right?
You are in it, girl.
I am.
Yeah.
And exactly what, like, why was it so hard? Why did I almost pee my pants? Why? I know this, like, I know all of this. Why is it so hard for me to hold in my pee? So things, it's not, like we can't just like think ourselves better. I tried to do that for a while. That was my holdup of like, yeah, but I know all of this, so I'm somehow immune, and I'm
Oh, yeah.
absolutely not. So that in combination with teaching a student a new an exam technique that she hadn't used before, and having her practice on me, and I was like, okay, so like I'm doing my Kegel, and she's like, and
Oh,
I was
no.
like, oh no.
Yeah.
No.
Oh, no. Yeah.
that my muscles were not robust enough for her to be able. So basically, like I was sitting on the table clothed, and her hands were under my butt. And so like pinky and ring fingers are going to be making contact with the external pelvic floor muscles. And so you should feel a lift and a lower. And she was like, nothing's moving. So now I do many more Kegels with my patients.
Together.
So yeah, like I had that postpartum experience, but then now having this perimenopausal, like, yeah, give yourself the treatment and the attention.
Oh, you hit on 2 topics I want to talk about.
Okay.
But I am I'm glad you had that experience, because I just did a little Kegel when you
Uh-huh.
did the little, and I'm like, I mean, I think I can feel it, and I'm doing it now. But, it does make sense to go to a professional so they can say, yeah, that's not actually what it should feel like. That's
Yes.
not actually correct. There's weakness here. Oh man, that's an awesome experience to have for you as the provider, teaching a student, so a future provider, and then just for the self-awareness
Right.
for your own sake. So,
Because
yeah.
I always feel kind of bad, because I'll have women that are, in their 60s, we'll say,
Mhm.
and they're like, so this is maybe, to go back to an earlier question, another reason that people don't make that initial visit is that they think it's just Kegels. So like,
Yes.
I'm in
Yeah.
my 60s, I've been doing that stuff since 1973. What are you going to teach me?
Yeah.
And so many of those patients have to be like, okay, I recognize you've been doing something since 1973, but it is not a Kegel. It is squeezing your butt cheeks, or
Mm.
like pulling up with your diaphragm, and so many. But also I have people that I'm like, do a Kegel, and they're like,
No idea what that is.
I don't know what you're saying or how to make my body do that.
That's
So
so vast.
that's
Wow.
100% like the biggest reason to make an appointment is just to know if you know how to find those muscles, right? Like learn what a Kegel is, because it's not enough for your primary care doc to be like, do Kegels. Like,
Do Kegels. I
that's
get it all the time. Or on social media, my patients will be like, yeah, I did the Kegel with the girl on social media. I'm
Mhm,
just fine. But then
mhm.
why are you telling me that sex hurts and you're leaking?
Right. Not fine.
Connection?
Yeah.
So that's a great another great reason to go see a professional to make sure that what you've been doing since 1973 is actually correct.
Mhm. And it is not a waste of time for somebody to come in and for me to ask all my questions and to do an exam and say, like, girl, you're good. You don't need to be here. Like, I am happy to have that conversation and give someone reassurance, give them maybe some things that they could do again preventatively, like let's keep
Hmm.
your muscles in such good condition. But that's like, nobody's going to be mad at you because you're like too good for PT. That's great. That's a fun conversation to have. So even if you're, and I say this when we do the group class, like if you think maybe you should go to pelvic PT, you probably should. Like there's something going on there that is not quite right or not what you want to be happening in your body. And that's enough reason. Like we don't need to let it get worse.
Please. Oh, I mean,
Right.
please.
I
Maybe
know.
let's